People do not buy medicine the way they buy ordinary products. They approach a pharmacy counter with a mix of urgency, fear, and hope. The current user experience of verifying that medicine is entirely visual. A parent picks up a bottle of cough syrup, checks the manufacturer's name, reads the batch number, and finds the expiry date. Everything looks completely normal. But flawless cardboard and intact foil can hide a dangerous reality. An authorized medicine might fail quality standards due to poor storage, or a counterfeiter might design a tablet that looks identical on the outside, while cracking open to reveal substituted or contaminated ingredients on the inside. This visualization maps out World Health Organization data, revealing that in low and middle-income countries, 1 in 10 medical products is substandard or falsified. That hidden 10% costs economies an estimated $30.5 billion every single year and actively contributes to antimicrobial resistance. We are forcing patients to judge chemical authenticity with their naked eyes. Placing the burden of becoming a medicine detective on a sick patient is a design failure. India is not starting from zero. The country operates a massive, active regulatory system with state drug controllers and extensive laboratory testing networks. Government laboratories test well over 100,000 samples annually. When a batch fails, the Central Drug Standard Control Organization issues public alerts declaring specific batches as not of standard quality or spurious. The breakdown happens in the communication architecture. This life-saving data is frequently trapped in static PDF files uploaded to regulatory websites. Most patients never see these alerts, meaning the data is effectively hidden from the public. Even recent traceability mandates, like QR codes on the top 300 drug brands, often stop at static text. A QR code that only shows a manufacturer's address can be easily copied and printed by the exact counterfeiters the system is trying to stop. The core design question is this: how do we restructure this broken communication loop so that critical safety data reaches the patient before they swallow the pill? The solution is a comprehensive verification layer. We call it the Medicine Trust OS, a system designed to carry verifiable trust from the factory floor directly to the patient's hands. We start by upgrading the physical package. This diagram illustrates the shift from a static barcode to a dynamic trust QR. It connects directly to a live database containing the exact batch, expiry, and current lab status. Because the connection is live, the status can change instantly. If a batch fails a spot check lab test weeks after it has shipped, the QR code updates into a pulsing warning before the next patient scans it. Behind these codes sits an AI risk radar. This system continuously monitors the back-end data to detect impossible physical behaviors that human inspectors would miss. For example, if the exact same unique QR code is scanned in Mumbai and Delhi at the precise same moment, the AI instantly flags a duplicate scan pattern, proving that copied packaging has entered the market. A digital barcode should never be a decorative sticker. It must operate as a live security signal. Next, we have to fix how safety alerts travel. We need to replace passive monthly document uploads with an active routing system. When a batch is declared substandard, the alert to patient flow bypasses the silo. Notice how the central system targets the exact nodes that interact with the drug. At the pharmacy level, digital inventory systems receive the signal and automatically flag the dangerous batch, freezing the stock before a pharmacist can even scan it at the register. For the end user, patients who previously scanned the medicine or purchased it through an e-pharmacy receive a direct digital notification. The message provides clear, non-panicked instructions on how to safely return the specific batch. A safety alert is useless if it stays in a PDF. Effective design pushes the warning directly to the point of risk. A digital-only solution creates a massive blind spot. Relying entirely on smartphone applications excludes millions of offline and low-literacy patients who are highly vulnerable to informal medical markets. To solve this, the OS integrates assisted medicine trust points, creating a physical verification layer for rural and offline communities. Users can verify batch numbers through simple SMS texts, toll-free voice prompts, or pharmacist-assisted scans at the counter. This equips community health workers and primary health centers with the tools to act as physical trust verifiers for entire villages, requiring no extra hardware from the patient. A system that secures medicine only for those with high-end smartphones is not a public health infrastructure. Safety design has to be accessible to everyone. Let's run a stress test on this integrated system. Imagine a dangerous batch of antibiotics is discovered in circulation. The response is automated. The moment the lab confirms the failure, manufacturers are pinged, distributors halt, and pharmacy shelves nationwide are digitally frozen. But the recall doesn't stop at the supply chain. SMS alerts reach directly into the patient's home, initiating a safe, guided return of that specific batch before another dose is taken. The OS also creates a quality signal loop. Doctors treating patients who mysteriously fail to respond to the antibiotics can report these anomalies directly back into the system, flagging bad batches early based on real-world treatment failures. A modern product recall should never stop at the warehouse door. It has to extend all the way to the patient's medicine cabinet. No structural design will ever stop criminals from attempting to manufacture falsified medicine. What this OS does is eliminate their hiding places. It dramatically shortens the response time between a lab test and a patient's awareness, making quality visible at every step of the supply chain. Medicine is a promise between the health system and the patient. We need to stop asking patients to act as quality control detectives and instead build an environment where every single pill carries trust by design.